Welcome to the Memorizing Pharmacology podcast. I'm Tony Guerra, pharmacist and author of the Memorizing Pharmacology book series, bringing you mnemonics, cases, and advice for succeeding in pharmacology. Sign up for the email list at memorizingpharm.com to get your free suffixes cheat sheet or find our mobile-friendly, self-paced online pharmacology review course at residency.teachable.com/p/mobile. Let's get started with the show. All right, welcome to the Memorizing Pharmacology podcast. Today I'm going to go over the Prazosin alpha blocker mnemonic and talk a little bit about stems and indications and all that stuff. So first thing you need to know when you're looking at an alpha blocker, it's probably going to end in AZOSIN. I'll talk about some other ones that end in OSIN and how those are a little bit different. But Prazosin, Doxazosin, Terazosin, some people pronounce it Doxazosin, Terazosin, tomato, but these are three of the big ones that you'll see when we're talking about alpha blockers. So the big thing is to take Prazosin, the word, and look at the indications. So the PR in Prazosin for prostate helps with BPH or benign prostatic hyperplasia. Take the RAZ, R-A-Z in Prazosin for the Raynaud's, and I know it's spelled with an S, but it's actually sounded out like a Z, so R-A-Z, and then the in at the end for hypertension. So again, those can help you remember the kind of three main reasons why you would want to use an alpha blocker. Prazosin has fallen out of favor because of the side effects, but I'll talk a little bit more about that in a minute. So how does it work? So mechanism of action is alpha blockade. So we relax the bladder neck, so the prostate. Vasodilation is how it helps with Raynaud's. And Raynaud's, if you don't know what that is, it's fingers and toes kind of get really cold because you have some vasoconstriction. So a little bit of vasodilation hopefully warms the fingers and toes up. And then vasodilation, again, helps with that hypertension. Okay. But the adverse effects also come from that vasodilation. So reflex tachycardia, your body's not happy that the blood pressure is going down because your blood vessels are opening, so your heart rate will go up. Orthostatic hypotension is that when you stand up, your blood pressure goes down, and this often results in something called first dose syncope or first dose fainting or first dose phenomenon. There's many different words for it. But on the first dose, your body's just not ready for this, and you faint or you drop. And so we'll talk about what to do about that. So in terms of contraindications, really kidney and circulatory disease is really the big one where we can't really use the alpha blockers. But in terms of that first dose syncope or the orthostatic hypotension, if you give it right at bedtime when somebody's going into bed, it's not a big deal. You're not going to fall down out of your bed. And then gradually sitting to stand, that's a big one with these. Sometimes you really have to be careful with it. But then, intuitively would think, okay, well, if you've got elderly patients, we really probably wouldn't want to use an alpha blocker. But let's talk about those more specific alpha blockers, Tamsulosin and Alfuzosin, Flomax and Uroxetrol. Because these really don't have those adverse effects of, as much as Prazosin, Doxazosin, Terazosin, these are really favored for BPH. Patients are much happier with these medications, and so they've gained tremendous popularity. In terms of what they're for, it makes it pretty clear with the Flomax and Uroxetrol, so allowing you to have more maximum flow as it relaxes the bladder neck, or urine control, kind of something like that. Right. And what I do want to mention, though, is that when you're using those alpha blockers, you're helping with BPH in the short term. So patient enjoys, quotation fingers, enjoys some relief from their condition in the beginning, but you haven't fixed it. To fix it, you actually have to reduce the size of the prostate, and those are the 5 alpha reductase inhibitors: finasteride, prostate care, or Proscar is the brand name. It also helps with hair loss, so that's why they call it Propecia, the opposite of alopecia. And then dutasteride, which is Avodart. These actually reduce the prostate size, but these can take 6 to 12 months for maximum effect. So that's why you have the alpha blockers in the short term, and then these will be added, and then these help in the long term. So again, a disclaimer, this is just for informational purposes only. It's not medical advice. If you have a medical condition, consult a medical professional. So thanks again for listening to the Memorizing Pharmacology podcast. Thanks for listening to the Memorizing Pharmacology podcast. You can find episodes, cheat sheets, and more at memorizingpharm.com. Again, you can sign up for the email list at memorizingpharm.com to get your free suffixes cheat sheet, or find our mobile-friendly, self-paced online pharmacology review course at residency.teachable.com/p/mobile. Thanks again for listening.